Indian medical fraternity and the patient fraternity is undergoing quite a dramatic changes in the present situation. There is a lot of disrespect and dishonesty which has been perceived in the relationship of doctors and the patients. It's quite disturbing for all of us, because in both ways we are the loser, the patients as well as the doctor as well as the hospitals, because there's too much of caution which has come into the practice, and nobody seems to be willing to take any risk, whatever small or big it may be. Medical fraternity and the hospitals are also getting disturbed with the legal issues and social haggling which is going around. Lot of it is the misconstrued ideas which are generated by going through the internet, Google and other social and digital media, which may or may not have the correct interpretation of the scientific situation. It's detrimental for the nation, because this distrust will create a great confusion among the patients and the professionals who are there at the service almost 24 hours of every day. Any doctor has a social responsibility and as a professional responsibility is always trying to do the best for their patients, and I'm sure the patients also feel the same way. But when things go wrong, the blame game starts, which is no way any fruitful either for patient or the doctors. If we talk about the investigations, I think the common symptoms itself will lead to a lot of investigations. If we go by books, if you're prescribing a medicine, you have to look into so many other aspects of side effects, etc. for the medicine. And if you go by books and if you go by what is all published, we may not be able to prescribe the apt and the correct treatment and the management for any one of our patient, even for major or minor elements. We must understand that all the doctors and the medical science itself is always working against the nature. The nature wants to do something to harm the human body and ultimately to destroy it, but at the same time the medical professionals and the medicines and the surgery and the surgical interventions all will try to overcome that negativity created by the nature. It is just a matter of chance, it's a matter of time, and it's a matter of a situation which one will win. As we know, nature will be the final winner. At some time we have to give in and we have to accept what nature wants for that particular individual or for that particular patient, irrespective of his social position, his age, his relations, his social circumstances, his economical circumstances. It doesn't matter. The modern medicine over a period of time is becoming more and more expensive. The gadgets for diagnosis are more expensive today than what they were few decades back. The medicines and the treatment modalities which are available today are much more expensive, and there is no way where we can dramatically provide them the best option at a very, very low, unpractical cost. We all need to do introspection and see what is going wrong and try to correct it as and when and as and where it is possible.